This video is on the topic of political action in nursing. Some key definitions for us to understand before beginning are the following. Policy. This is a set course of action to be followed by a government or institution to obtain a desired end. Public policy is described as all governmental activities, direct or indirect, that influence the lives of all citizens. Health policy. In contrast, this is a set course of action to obtain a desired health outcome for an individual, family, group, community, or society. Politics is the art of influencing others to accept a specific course of action. Therefore, political activities are used to arrive at a course of action, the policy. Law. These are a system of privileges and processes by which people solve problems based on a set of established rules. An example of a public policy is found in the following: the Public Health Threats and Emergencies Act of 2000. This was the first federal law to address preparedness for bioterrorism and outbreaks. The second is the Public Health Security and Bioterrorism Preparedness and Response Act of 2002. This act upgraded the ability of health professionals to recognize and treat diseases caused by bioterrorism. It sped the development of new vaccines and other countermeasures, along with improving water and food supply. Healthy People 2020 is a national health policy. However, it is a national health policy guidance. It provides guidance for the development of national health policies. It has 4 overarching goals. The first, attaining high quality, longer lives, free of preventable diseases, disability, injury, and premature death. The second, achieving health equity, eliminating disparities and improving the health of all groups. Third, creating social and physical environments that promote good health for all. Fourth, promoting quality of life, healthy development, and healthy behaviors across all life stages. We are looking forward to Healthy People 2030. Currently, the U.S. Department of Health and Human Services is seeking nominations for members of the Secretary's Advisory Committee on National Health Promotion and Disease Prevention Objectives for the next decade, 2030. Organizations and agencies that influence health policy are multiple. The first would be international organizations. An example here is the World Health Organization. Federal health agencies. An example would be the National Institutes of Health. Federal non-health agencies. Examples here would be the U.S. Department of Labor, the U.S. Department of Agriculture. Other organizations that also influence health policy include state and local health departments, for example, the New York City Department of Environmental Protection. Scientific organizations such as the Global Network. Healthcare professional organizations, the American Nurses Association. And then foundations, some of which we have already visited during our multiple modules throughout this course. The Kaiser Family Foundation. Politics is the process by which the decisions of others are influenced and control over situations and events is exerted. Influence is the common denominator in any definition of politics. Forms of political influence include money, knowledge, relationships, information, talent, and control over large groups of votes. Through effective political action, nurses can positively influence legislative decisions and health policies. Politics is a necessary part of the policy process when multiple interest groups compete to achieve individual goals. So, for example, in the middle of this particular collage of different interest groups, we see the Philip Morris Company. And off below and to the left, we see ASH, which is the Action on Smoking and Health. Definitely two interest groups with competing goals. Politics also involves the varied agendas of the Democratic, Republican, and Independent parties. What are the skills that make up a nurse's political savvy? Well, they include the ability to analyze an issue, present a possible resolution in clear and concise terms, participate in a constructive way, voice one's opinion, understand the system, analyze and using power bases. Nursing advocacy is accomplished by building relationships with the appropriate policy makers, the individuals or groups that determine a specific course of action to be followed by a government or institution to achieve a desired end, the policy outcome. Relationships for effective advocacy can be built in a number of ways, and these are the following. Building coalitions. Coalition is a group of individuals or organizations that share a common interest in a single issue. The selection of coalition partners should strengthen your cause or organization. Build coalitions with people or organizations more powerful than you. Next, political action committees, or PACs. This is a mechanism whereby individuals can pool their resources and collectively support a candidate. The American Nurses Association National PAC is called ANA-PAC. There are state-level PACs throughout the country for the American Nurses Association. Grassroots political strategies is another way. Registering to vote and voting in all elections, joining a professional nursing organization, working in a candidate's campaigns, attending to meet the candidate's town hall meeting, visiting the policymakers or their staff, communicating with policymakers. How should you participate in the election process? Get involved. Know the candidates. Volunteer to help the candidate understand healthcare issues. Draft your position on healthcare. After getting them elected, then what? Well, attempt to influence or sway a public official to take desired action. You can do this by assessing a candidate's knowledge of healthcare issues, educating these officials, lobby face-to-face in writing, telephone call or telegrams. Be sure that they can reach you if they need to contact you by a business card or email address. Networking among your colleagues. Successful networking includes the conscious building and nurturing of a pool of associates whose skills and connections augment your own. You should build a network over your career. Reciprocate with your resources. The American Nurses Association is a good group with which you can find networks. It is the only full-service professional organization representing the nation's entire registered nurse population, from the halls of Congress and federal agencies to the boardrooms, hospitals, and other healthcare facilities. ANA is the strongest voice for the nursing profession. The American Nurses Association represents the nation's 3.6 million RNs. It is composed of 51 constituent state nurses associations that represent state and U.S. territory nursing associations and includes many organizational affiliates. Current ANA health policies include the following: healthcare reform, opioid epidemic, multi-state licensure compacts, safe staffing, barriers to RN scope of practice, workplace violence and incivility, nurse fatigue, workplace safety, patient safety. I urge you to visit the American Nurses Association advocacy link in order to see what nurses are doing within this organization to assist both the profession and also the patients for whom we care. If you have any questions, please place them in the discussion board for that purpose.